Hello, everyone. Today we're talking about something many people, especially older adults, experience joint pain caused by arthritis. But what exactly is arthritis? Let's break it down together in simple words. Arthritis is a condition that causes swelling, pain, and stiffness in the joints. A joint is where two bones meet, like in your knees, hips, fingers, or shoulders. These joints help you move smoothly, bend, walk, and do everyday activities like opening a jar or tying your shoes. When you have arthritis, these areas become inflamed. That means they can swell up, feel warm to the touch, and start hurting, especially when you try to move them. There are many types of arthritis, but the most common ones are osteoarthritis and rheumatoid arthritis. Osteoarthritis happens when the cartilage, the soft protective tissue between the bones, wears down over time. Imagine the cushion between your bones getting thinner so the bones rub against each other. That can cause pain, stiffness, and even a crunching feeling when you move. This type usually affects older adults and often shows up in the knees, hips, lower back, or hands. Rheumatoid arthritis, on the other hand, is a bit different. It's an autoimmune condition, meaning your immune system, which normally protects you from sickness, starts attacking your own joints by mistake. This causes swelling, pain, and can even change the shape of your joints over time. Rheumatoid arthritis can happen at any age, and it often affects both sides of the body, for example, both hands or both knees. You might wonder, what does arthritis feel like? It can vary from person to person. Some people feel a dull, aching pain. Others feel sharp pains or stiffness, especially in the morning or after sitting still for a long time. Sometimes the pain gets worse after using the joint too much, like after a long walk or doing housework. One important thing to remember is that arthritis is a long-term, chronic condition. That means it doesn't go away completely, but the good news is that there are many ways to manage it and feel better. Many people live active, happy lives even with arthritis. The key is to take care of your joints and follow helpful tips, which we'll talk about in the next sections. So, if you or someone you love has arthritis, don't panic. You're not alone. Millions of people around the world deal with joint pain, and there's a lot you can do to reduce the discomfort and keep moving. Stay tuned for the next part, where we'll share home remedies and simple things you can start doing today to help your joints feel better. Now that we understand what arthritis is, let's talk about simple and natural home remedies that can help ease the pain and stiffness. These are things you can do at home without needing fancy equipment or expensive treatments. Many people with arthritis say these small steps make a big difference in how they feel day to day. First, let's talk about heat and cold. Heat is very good for relaxing tight, stiff muscles and joints. When you apply heat to an aching area, like using a warm heating pad, a hot water bottle, or even a warm towel, it helps increase blood flow. This makes the muscles relax and reduces stiffness. Many people enjoy taking warm baths or showers in the morning because it helps loosen up their joints for the day. One easy idea is to soak in a warm bath with Epsom salts. Epsom salts are made of magnesium, which can help relax muscles and ease discomfort. Just add about 2 cups of Epsom salt to a warm bath, soak for 15 to 20 minutes, and you might feel much more relaxed afterward. On the other hand, cold treatments help when there is swelling or sharp pain. Cold slows down blood flow and reduces inflammation. You can use an ice pack, a bag of frozen peas, or even wrap some ice cubes in a thin cloth and apply it to the sore area. Remember, don't put ice directly on your skin. Always wrap it in something to protect your skin. Apply it for about 15 to 20 minutes, and you can repeat this a few times a day if needed. It's good to know when to use heat and when to use cold. Use heat when you feel stiff and tight, especially in the morning or after not moving for a while. Use cold when you notice swelling, redness, or sharp pain, usually after you've used the joint too much. Another very important remedy is rest. When you have arthritis, your joints work extra hard just to keep you moving. It's okay to take breaks. Avoid doing too much at once. For example, if you are cleaning the house, take short rests between tasks. If you like gardening or walking, stop for a few minutes to rest when you start feeling tired. Rest helps your joints recover and prevents more pain later. Along with rest, gentle movement is also helpful. You don't want to stay still all day because that can make your joints even stiffer. Simple stretches, slow walks, or light exercises can help keep your joints flexible and your muscles strong. Always listen to your body, though. If something hurts too much, stop and rest. Other natural remedies people try include gentle massages, using lotions with calming ingredients like menthol or capsaicin from chili peppers, and doing simple relaxation exercises like deep breathing. Stress can make pain feel worse, so learning to relax your mind can also help relax your body. It's also a good idea to pay attention to your diet. Some foods can make inflammation worse, while others help fight it. Many people find that eating more fruits, vegetables, whole grains, fish, nuts, and healthy oils like olive oil helps reduce joint pain. Cutting back on processed foods, too much sugar, or fried foods might also help. Drinking enough water is important too. Staying hydrated helps your body work better overall. Finally, a reminder. Natural remedies are helpful, but they are not magic cures. They work best when combined with advice from your doctor and a healthy lifestyle. If you're ever unsure about what's safe to try, it's always a good idea to ask your doctor or pharmacist. In the next section, we'll talk about simple exercises you can do to keep your joints healthy and strong. Small steps every day can lead to big improvements over time. Simple exercises to feel better. Now let's talk about something very important. Moving your body, even when you have arthritis. Many people think that when you have joint pain, you should just rest all the time. But actually, gentle movement is one of the best things you can do to help your joints feel better in the long run. When you do small, gentle exercises every day, you help keep your joints flexible, your muscles strong, and your body healthy. Movement also helps reduce stiffness and pain over time. Of course, you should always be careful. The goal is not to push through pain, but to keep the body active in a safe and easy way. One of the best things you can do is light stretching. Stretching helps improve your range of motion. That means how easily you can move your joints. You can do simple stretches for your hands, arms, shoulders, neck, back, hips, and legs. For example, gently roll your shoulders forward and backward. Slowly turn your head side to side. Stretch out your arms in front of you and gently open and close your hands. These small movements can help loosen your joints and make daily activities easier. Another great activity is walking. You don't need to walk fast or far. Just a short, slow walk around your home, your garden, or even down the street can do wonders. Walking helps keep your hips, knees, and ankles moving. It also improves blood flow and boosts your mood. Remember to wear comfortable shoes with good support, and if you need to, use a cane or walker for extra safety. Water exercises are especially good for people with arthritis. Moving in water helps you exercise without putting too much pressure on your joints. The water supports your body weight, making movements easier and less painful. You can join a water exercise class or simply walk back and forth in a pool. Even gentle arm or leg movements while standing in the water can help keep your joints active. If you prefer to exercise at home, you can try some chair exercises. Sit in a sturdy chair with good back support. Try slowly lifting one leg at a time, pointing and flexing your feet, or gently lifting your arms up and down. These simple movements help keep your muscles active without putting too much strain on your joints. It's very important to avoid sudden or heavy movements. You don't need to lift heavy weights or do hard exercises. These can hurt your joints and make the pain worse. Focus on small, gentle movements that feel good. If you ever feel sharp pain, stop right away and rest. It's normal to feel a little sore when you start a new movement, but you should never feel strong or lasting pain. One good tip is to warm up before you exercise. Do some light movements or apply a warm compress to your joints before you start. This helps loosen the muscles and makes it easier to move. After you finish exercising, you can use a cold pack if you feel any swelling or soreness. Also, remember to listen to your body. Everyone is different. Some people might feel better after a short walk, while others prefer light stretching or water exercises. The most important thing is to find what works for you and stick with it. Doing a little every day is better than doing too much all at once. Finally, be patient and kind to yourself. You might not see big changes right away, but over time, these small exercises can help reduce stiffness, improve strength, and make daily tasks easier. You don't need to be perfect. Just doing your best each day is enough. Paragraph 4. When to ask the doctor for help. Now let's talk about something very important. Knowing when it's time to ask your doctor for help. Even if you try natural remedies, gentle exercises, and rest, sometimes arthritis pain can still get worse. Maybe the pain lasts too long, or maybe it becomes too strong and starts making daily life very difficult. If this happens, don't wait or try to handle it all by yourself. It's time to talk to your doctor. Many people feel shy or embarrassed to ask for help, but you shouldn't. Taking care of your health is a smart and brave thing to do. Your doctor is there to help you feel better and to find the right treatment that fits your needs. So, when should you see the doctor? Here are some clear signs. If your joint pain gets much worse and doesn't improve with rest or home care. If you notice more swelling or redness in your joints. If the joint feels hot or looks infected. If you have fever along with joint pain, this could mean there's an infection. If you have difficulty doing daily activities like walking, dressing, or eating because of the pain. If you feel sad or frustrated because the pain is affecting your mood and life, your doctor can help you in many ways. One common option is giving you pain relief medications. These can include pills like ibuprofen or acetaminophen, or stronger medicines if needed. There are also creams or gels that you can rub on the painful joints to help reduce swelling and discomfort. In some cases, your doctor might recommend physical therapy. This means you'll work with a therapist who teaches you special exercises and stretches that strengthen the muscles around your joints. A physical therapist can also show you how to move safely and protect your joints during daily tasks. For people with very bad arthritis, doctors might suggest other treatments like joint injections, medications injected directly into the joint, or even surgery. But remember, these are usually only needed if other treatments don't help. One more important thing: tell your doctor if you are already taking other medications or have other health problems. This helps them choose the best treatment for you without causing side effects or problems. It's also a good idea to prepare some notes before your doctor visit. Write down when the pain started, which joints hurt the most, what makes the pain better or worse, and what activities are hardest for you now. This will help the doctor understand your situation better and give you the right advice. And don't be afraid to ask questions. You can ask things like, what kind of arthritis do I have? What treatments are best for me? Are there exercises or activities I should avoid? How can I protect my joints in daily life? Remember, you are not alone. Millions of people around the world have arthritis, and many of them live happy, active lives with the right care and support. Talking to your doctor is a key step to feeling better and staying independent. Taking care of your joints means taking care of your whole life. So be gentle with yourself, ask for help when you need it, and keep doing your best every day.